Nope, we're not there yet. AI in medicine isn't brand new. It's been around since the 1970s. Back then, there was a system called Internist 1. It could ask doctors questions, consider symptoms, and come up with a diagnosis. It even explained its reasoning, kind of like a chat with an expert. But there were problems. At that time, there were no electronic records and no real-time data. Doctors had to enter everything manually into massive computers. It was powerful but slow, and definitely not built for daily use. Fast forward to now. Hospitals are flooded with information. We've got lab results, MRIs, genetic tests, doctor's notes, all being recorded digitally, and AI can finally keep up. It's like giving doctors a second brain, one that never sleeps and remembers everything. Take cancer, for example. Some types have dozens of treatment options, but not all of them work for everyone. AI can study thousands of past cases, comparing symptoms, side effects, outcomes, and help doctors choose the therapy that's most likely to work for someone just like you. These algorithms are especially good at detecting patterns, subtle connections across data that humans might miss, but it doesn't always outperform the simple methods doctors already use. And that's because a lot of medical tests were designed for people to read, not machines. To really help doctors, AI needs better data. Data that's more detailed, more regular, and more connected to real life. At MIT, Professor Dina Katabi and her team created a device called Emerald. It looks like a Wi-Fi router, but it does something completely different. It uses wireless signals to track movement, breathing, and heart rate, without cameras, without microphones, and without anyone wearing a thing. Let's say your grandfather lives alone and falls down the stairs. Emerald notices. It sends an alert. If his breathing changes while he sleeps, it can flag that too. It's quiet, invisible, and it could save lives, especially for people managing chronic illness at home. But AI isn't just helping at home, it's helping in the clinic too. Doctors spend hours every day writing notes. It's one of their biggest sources of burnout. But now, AI tools powered by large language models like GPT-4 can listen during appointments and generate those notes automatically. Instead of typing for 2 hours after every shift, a doctor could be spending that time actually helping more patients. Medical notes are full of complicated terms, like instead of saying high blood pressure, they'll write hypertension secondary to idiopathic factors. Helpful? Not really. AI can translate all that into plain language. Still, there's a big challenge. AI only works if it has access to high-quality, unbiased data. However, a lot of that data isn't being collected, or it's stuck in disconnected systems, or privacy rules make it hard to share. That's why national efforts matter. An example is the All of Us initiative, which gathers health and genetic data from over 1 million Americans with the goal of building more inclusive, more powerful tools for the future of medicine. And one of AI's biggest promises, connecting the dots that humans might miss. It's not about replacing anyone. It's about helping the people who help us work smarter, move faster, and care more deeply. So no, your next checkup probably won't be with a robot in a lab coat. But behind the scenes, AI just might be the secret weapon making your care safer, faster, and more personalized than ever before. If you enjoyed the video, make sure to like and subscribe. Thank you, and see you in the next video.